Keeping the feet wide, start to rock the knees gently from one side to the other side. Noticing how that gentle movement feels through the hips and low back. Maybe even taking the arms out to a T position, bringing the head, neck, and gaze to the opposite direction of the legs. Legs fall to one side, head, neck, and gaze to the opposite side. Good. Coming back through center, pick the feet up off of the mat, hug the knees in towards you, wrap the arms around the legs. First, just squeezing the knees in toward the chest, feeling some flexion move into the hips, into the low back. Then you can start to draw some circles here, one hand on each kneecap, draw the knees wide apart and back together again a few times. Taking it nice and slow, allowing your hip joints to warm up. Noticing how the hips feel today. Good. We'll draw the knees wide apart from one another and hold here. Hands can be on the insides of the knees here as you press the knees wide apart from one another, feeling a stretch through the inner hips, inner thighs. Breathing into that sensation of the stretch in the adductor muscles, the inner thigh muscles. Good. Let's draw the knees back towards one another, planting the feet on the mat. Let's do a few pelvic tilts here. So arms can be by the sides, palms facing down. With the inhale, curve the lower back away from the ground. With the exhale, press the low back flat down into the mat. Syncing your breath with this super subtle movement of the pelvis and low back. Notice as the belly expands when you curve the low back away from the mat. As you press the low back down flat, feel the belly button draw toward the spine, engaging the abdominals slightly. One more of each. Good. Then from here, back to a neutral position. Bring the soles of the feet together, knees out wide apart into bound angle. Allowing the hips to just settle into this here at first. You can butterfly the legs a few times if that feels nice. You can rock the hips side to side a couple of times as well. Allowing your body to get adjusted into this pose. Maybe feeling that gentle stretch through the inner hips or just the opening of the hips in general. Then we'll add a few pelvic tilts here. So the hands can either be just on the mat or maybe the hands can be placed on the belly or hips to just help you kind of guide yourself into the movement a little bit better. With the exhalations, same idea, pressing the low back down flat into the ground. With the inhales, curve the low back away from the mat. Exhales, press the low back down firmly into the floor. Inhales, curve the low back away from the mat. With the inhales, as you curve the low back away, the legs relax, the glutes relax. On the exhales, press it down flat and feel the knees lift up slightly, contracting the glutes, contracting the core. Two more of each. Good. Back to a neutral position in the pelvis, but still staying in this bound angle position. Arms by the sides, palms face down. We'll try a few bound angle glute bridges. Press the soles of the feet firmly together here. You'll notice that the inner thighs will want to engage here as you do this, maybe the outer legs and glutes as well. Really getting that engagement before you lift up. When you're ready, press the hands firmly down. Press the tops of the shoulders down into the mat as well as you lift the hips and low back away from the floor. Squeezing the glutes. With your next exhale, relax the glutes as you slowly lower down, allowing everything to relax, and then lifting back up again once you're ready. Pressing the soles of the feet together, engage the inner thighs, lift the hips up, lift the low back up off the mat as well. Squeezing the glutes together, find that engagement. And on your next exhale, lowering back down, relaxing everything at the bottom here before lifting back up again. So we're almost taking it like a somatic style exercise where we have this contraction and then complete release before contracting again. One more round. Good. As you're ready, slowly bring the knees towards one another. And then picking up the feet once again, wrap the arms around the legs, hug the knees into the chest. From here, rocking side to side, giving the low back a little massage. As you're ready, you can go ahead and roll over onto your left side. We'll set up here for our somatic exercises in the hips. So going through some abduction through the hips, some internal and external rotation. Let's bend the knees up to about 90 degrees so that they're in line with the hips and that the ankles are in line with the knees as well. And it's really important to make sure the shoulders are stacked in alignment with the hips. So just getting all of that alignment in place. You can take the top hand, place it on the top hip, just to make sure you're not rotating the hip back at all. So what we'll do here is keep the ankles glued together, lift the top knee away from the bottom knee only as far as you can without rotating that hip back. Keep them stacked. Lower that knee all the way down, relax completely at the bottom before lifting that knee back up again. This is a great exercise for engaging and strengthening the glute medius, which is one of the side glute muscles we've talked about before, and it's a really important muscle in pelvic stabilization. So if the hips are kind of tilted off slightly, one hip is lower or higher than the other, which is often the case, which causes low back pain and hip pain as well. Strengthening the glute medius will really help to realign that pelvis. We'll do one more. And lower that knee down, completely relaxed. Take a full cycle of breath. And keep both knees glued together. This time we'll lift the top foot away from the bottom foot. So you'll notice that the thigh bone will rotate internally, internal rotation of the hip. You want that to happen. Lowering the foot all the way back down, relaxing completely. And then lifting the foot back up again. Keeping the knees glued together, top foot lifts away from the bottom foot, then lowers back down. Remember to relax everything completely at the bottom of the exercise before lifting that foot back up again. You can use your breath to control this movement as well. We'll do one more of these. Good. Lower that foot all the way back down. Take a full cycle of breath through the belly. In through the nose, feel the belly expand. Maybe out through the mouth. Good. The next movement is lifting the entire leg. So see if you can keep the ankle and knee of that top leg relatively in line with one another as you lift that entire leg away from the bottom leg. Again, only lifting so far as to not rotate the pelvis at all, keeping the hips stacked over top of one another. Relaxing that leg down completely, and then lifting back up again. A few times here, slow and controlled. Might feel a bit tedious, but you're really getting into these intrinsic muscles of the hips that are going to help to strengthen, stabilize the pelvis. One more of this one. All right, relaxing that leg back down, relaxing completely by taking a full cycle of breath. All right, before we switch sides, I have one kind of bonus challenge activity. If you'd like to try it, you can. If you'd like to just take a rest, feel free to do so. So for the challenge activity, lift that top foot away from the bottom foot again, so you're internally rotating the hip. And then see if you can pick the knee up, so lifting that top knee away from the bottom knee as the leg is in internal rotation. Pressing the foot toward the ceiling, you'll feel the glutes really contract here. And then lower just the knee back down. Keep the leg in internal rotation here. Then press the foot up toward the ceiling. So try a couple rounds of this if you'd like. A little bit of a challenge, really activating the glutes here. 2 more. Awesome, lowering that entire leg back down, relaxing the glutes, and then we'll get ready to switch sides here. So we'll switch sides like this for demonstration purposes, but do whatever you'd like. Finding that alignment again, the shoulders are stacked in alignment with the hips, the knees are in alignment with the hips, and the ankles are in line with the knees as well here. Keep the feet glued together, the ankles glued together. Lift the top knee away from the bottom knee, and relax that leg back down completely. So continue like this, lifting the top knee away, then lowering it down, relaxing completely before lifting back up. Remember to keep those hips stacked over top of one another, trying not to cheat to get more range. It's okay if it's not a big movement here. That's not the goal. Staying within that small range, perhaps, just making sure that you focus more on your alignment instead. Two more of this one. Good, lowering that knee back down completely, relaxing everything. Relax the entire body. Take a full cycle of breath. Then keep the knees glued together here. We'll lift the top foot away from the bottom foot, internally rotating the hip, and lowering that foot back down. So a little less contraction here than the first one, but definitely focusing on active mobility here through the hip. Using your breath to guide the movement, still being really present of what's happening in your body here. I know it's a small movement, it might not feel like a lot, but if you pay attention to all of the intricacies of this movement, it's a lot to focus on. Coordinating it with your breath. Good. The next time you lower that foot back down, completely relax. Take a full cycle of breath. And then lifting that entire top leg away from the bottom leg. Trying not to rotate the pelvis here. Really keep the hips stacked. Lower the entire leg back down. Relax everything. Then lift back up again. You can even have the hand on the low back just to make sure you're not rotating the hips at all in this movement. So if you suffer from low back pain, this really is a game changer to strengthen glute medius. It's often said that if you strengthen glute medius, your back pain might even just go away just by doing this. I can't promise anything though. Good, we'll do one more of this one. Full cycle of breath, in through the nose, and perhaps out through the mouth. Good. Either resting or trying the challenge activity by lifting the top foot away from the bottom foot and kind of internally rotating the hip almost slightly forcibly here so that the top of that left thigh is down onto the bottom leg. Keeping that internal rotation, pressing the foot toward the ceiling, lift the knee away. Keep the leg in internal rotation as you lower the knee back down and then lift it back up again. You're trying to keep the leg in that internal rotation the entire time, pressing up and lowering down. Definitely a difficult one, challenging those muscles of the hips. Challenging glute medius and minimus really a lot here. They're responsible for internal rotation of the hip. This really gets them firing. Also abduction, which is the motion of lifting the leg. And relaxing that leg down completely. Taking a full cycle of breath. Then as you're ready, you can go ahead and press on up to a child's pose here, placing the knee pads if you'd like. Knees a little bit wider, big toes to touch. Press the hips back to the heels. Reach the arms out in front of you. Stretching the arms out, reaching the fingertips towards the top of the mat. Keep the elbows lifted up off of the ground, maybe even getting a nice stretch through the armpits. Feeling a stretch perhaps into the low back and hips here as well. Make a conscious effort to send your breath into the backs of the ribs and the low back.